Let's talk a little bit about carbon monoxide. All right, so I want to take you back to an incident that happened a few years ago. It was in Cutler Bay, Florida, 2017, down in South Florida. Guy calls 911 because he found his wife and his daughter unconscious inside the house. As he was calling 911, he states that he started feeling headache, weakness, dizziness, and so on. So the fire rescue crew gets there. They are a crew of 3 people. They walk into the house to make an assessment. They become symptomatic as well. They retreat out of the house. They go back to their truck. They put on their SCBA and turnout gear, go back into the house, make the rescue. Once they make the rescue, they bring all 3 out into the front yard. One thing leads to another. It turns into a hazmat call. After the upgrade to the hazmat call, hazmat guys meter the house. When they meter the house, they find about 650 parts per million carbon monoxide in there. The family of 3, the father, the mother, and the daughter, were all 3 transported to the hospital, and the 3 firefighters on the rescue crew were also transported to the emergency room. The daughter, who had the worst signs and symptoms and had the worst Glasgow coma score, she was transported to a hyperbaric chamber and treated in hyperbaric chamber. So let's talk about carbon monoxide a little bit. What is it? We've looked, we learned during EMT school and firefighting and minimum standards and all those things. And we learned that, it's a colorless and odorless gas. But what does that really mean, right? So if it's a colorless gas, usually you can associate carbon monoxide with smoke. So if you can see the air, I usually tell a lot of my students, if you can see the air, it's not good for you. And you should probably wear respiratory protection. So if you see smoke, you can assume that there's carbon monoxide. The thing is that carbon monoxide can be present without smoke, so you don't see it, right? So that's kind of a given. The whole thing about the odorless part is twofold. One is that usually something that has an odor or is water soluble and causes damage and starts to irritate the upper airways will force the victim to self-rescue. They'll get out of the room, they'll get out of the building or whatever, or out of the area. When it's odorless and it's also not water soluble, it goes through the nose and the mouth, down through the airway, in through the lower airways, in through the alveoli. And once it gets into the alveoli, gets breathed out, gets breathed back in, breathed out, breathed back in. This causes a prolonged exposure because the patient doesn't have immediate signs and symptoms. They sit in that environment and they continue to breathe the poison. All right, most accidental deaths involving carbon monoxide are due to house fires, automobile exhaust, indoor heating systems, stoves, and other appliances, gas-powered electrical generators, charcoal grills, camp stoves, water heaters, and get this, boat exhaust. Every year at the end of July, beginning of August, lobster season starts in South Florida. So people dive for lobster. Now, what they need to do is they need to go along the reef and along some of these grass beds, and they look at the ledges of these rocks, reefs, grass beds, and things like that. And they find lobster underneath these ledges. Well, in order to cover more ground, what they'll do is they'll throw a line or a rope off the back of the boat, hold on to that, and have the boat tow them around. And when the boat tows them around, they find a spot that they like, they let go of the rope, they dive down, they find their lobster. The problem is that they're being dragged around behind this boat and the exhaust is coming right across the water into the snorkel. So you actually have a few carbon monoxide injuries and sometimes a death or 2 every year during lobster season. Now that brings us to another South Florida favorite, hurricanes. When a hurricane comes through, the power goes out. When the power goes out, people turn on generators. Now, not everybody has a generator, so your generator can get stolen. So here's what they do. People will come up to your house. They go around the back of the house. They'll find your lawnmower. They'll start up the lawnmower, put it right next to the generator. Sounds the same. kill the generator, and walk away with it. So you hear the engine running outside. Usually you're not running a lot of lights. You're not running your air conditioner. It's usually the refrigerator. So you don't know that your generator's been stolen until it's too late. So as a result, people actually will bring their generators close to them and they'll sleep next to their generators. So imagine that you are sleeping in your master bedroom. You have your window off to the left side, or maybe your window is behind you. You put your generator right on the other side of the wall outside. But if it's a no wind day or you're on the windward side of the house, that exhaust starts to go into the bedroom. So let's look at that firefighting risks. So when I came onto the fire service, it was during a culture change. That older generation refused to wear their SCBA. So basically, we'd have our fire, guys would put on their SCBA, guys would mask up, and they would go knock the fire down, come back out, take off all their stuff, and then they would go back into the house and then start doing overhaul, pulling ceiling, or whatever. The problem, as you guys all know, is that the carbon monoxide stays in the house. Even though you don't see it, even though the smoke is cleared, carbon monoxide is still in there. Nowadays, it's a lot better. I've noticed a lot of my firefighters are following that culture of safety, and everybody is wearing an SCBA during overhaul. And that's a good thing. Some other areas that you can get carbon monoxide during firefighting operations is structure fires, of course, apparatus fumes or exhaust, portable equipment exhaust, underground utility fires, confined space rescue situations, and so on. All right, so how does this whole carboxyhemoglobin carbon monoxide poisoning work? Let's go back to oxygen first. So oxygen, it's in the air, it's 21% oxygen in the air. You take a breath in, it goes in through the mouth or the nose, it goes down into the upper airway, the lower airways, down through the bronchial tree, it goes down into the alveoli, and then it passes across the alveolar capillary membrane. Once it gets across there, it is in the capillary or the pulmonary capillary. Then it's considered to be, quote, in solution, right? The next step is for a red blood cell to come along and attract that oxygen to hemoglobin. And it does that with the iron that is in hemoglobin, attracting the oxygen to a very loose bond. Now, when the oxygen binds with hemoglobin, the iron in that hemoglobin lets off a red pigmentation. It turns red. And that's what turns the red blood cell red and gives you that appearance of oxygenated blood or bright red arterial blood. Enter carbon monoxide. It enters through the mouth or nose, goes down through the airways or bronchial tree, gets into the alveoli, crosses the alveolar capillary membrane, gets into solution. So now the red blood cell comes along and there's a stronger attraction and a stronger bond with the carbon monoxide and the hemoglobin. In this case, if there is an oxygen molecule on hemoglobin, the carbon monoxide would actually kick it off. Now the oxygen is in solution, the carbon monoxide is binding to hemoglobin, and when it binds to hemoglobin, the iron turns red. And when it turns red, it gives the appearance of bright red arterial blood or oxygenated blood. Now let's look at some of the signs and symptoms, okay? It's really signs and symptoms of hypoxia without cyanosis, because remember, you have the carbon monoxide attached to the hemoglobin. Not only is it turning it bright red, but it's not getting off. So it goes through capillary and back through venous circulation. It's still stuck to the hemoglobin. So you'll have hypoxia without cyanosis. Some of the other signs of hypoxia are, shortness of breath, tachypnea, difficulty breathing, altered mental status, CNS depression, decreased cardiac function or shock. And then the patient can also start to develop non-cardiogenic pulmonary edema. Take a look at this list of signs and symptoms of carbon monoxide. This is something that we pull from a couple of different textbooks and we put them all together. And there are so many signs and symptoms of carbon monoxide: malaise, fatigue, difficulty breathing on exertion, lethargy, flu-like symptoms, drowsiness, dizziness, weakness, confusion, syncope, seizures, of course, How about these? Impulsiveness, distractibility, hallucination, confabulations, agitation, nausea, vomiting, diarrhea, and so on. Okay. So there are plenty of different signs and symptoms of carbon monoxide poisoning. One thing that they are noticing is that people, or firefighters, or people who have chronic or repeated exposures to carbon monoxide end up having psychological issues later on in life. This thing right here, the pulse ox, can give you a false reading. So why does it do that? When you turn this thing on, there's a little, I don't know if you can see it, there's a little light on the inside. There's a infrared and a red light that pass through tissue, and then you're looking at reflected, absorbed light. The machine does a calculation and then gives you that determination of redness of blood, and it tells you a percentage of oxygenated hemoglobin or attached hemoglobin. Because remember, if carbon monoxide attaches, it's still going to turn red, and the pulse oximeter is going to measure attached hemoglobin regardless of whether or not oxygen or carbon monoxide is on it. And that's going to give you a false reading. So now you have somebody with difficulty breathing, altered mental status, going into shock, and they have a pulse ox of 99%. So now another thing that can happen is the patient can present with cherry red skin because the superficial capillaries are transporting highly attached hemoglobin, not necessarily oxygenated hemoglobin, but attached hemoglobin, bright red. And as they're bright red, you can start to see that in the skin. The problem is that cherry red skin is usually found post-mortem. So how do we treat carbon monoxide poisoning? The antidote for carbon monoxide is oxygen. When we're administering oxygen, we're trying to achieve a reduction in carboxyhemoglobin half-life, right? Now, the carboxyhemoglobin half-life on room air without any oxygen is 240 to 360 minutes. Now, if we were to administer high flow oxygen to this patient, that carboxyhemoglobin would drop to 80 to 90 minutes. Hyperbaric oxygen therapy will bring carboxyhemoglobin half-life down to 20 to 30 minutes. So that's the next step in providing oxygen to the patient, is to give more oxygen molecules every time the patient breathes in. Well, a common misconception, though, is a lot of hospitals have hyperbaric chambers, but they're hyperbaric chambers for wound care. Okay. And that is not going to be able to support your carbon monoxide patient. The hyperbaric chamber that is used for carbon monoxide poisoning is the same one that is used for diving injuries. It's called a multi-lock, multi-place hyperbaric chamber. All right, so this is how it works. So you have the patient who is in the patient care compartment, which is the largest compartment of the hyperbaric chamber. It can hold several people. It all depends on the configuration of the chamber. The attendant, which is the doctor, nurse, medic, or whoever, goes into a different chamber. What they do is they get into this chamber, close the doors, and then they pressurize, or they dive to the pressure that the patient is in. Once they reach that pressure, they open up the inside door, walk in, start taking care of the patient, do whatever needs to be done, change the IV, check vital signs, and so on. When they're done working, they come back out, they go back into that decompression chamber. They start to slowly decompress until they reach the ambient pressure, and this will go on until the patient is finished with the hyperbaric chamber. This hyperbaric chamber should have the ability to compress to 2 to 3 atmospheres and do it for about 24 to 48 hours, depending on the type of injury that the patient has. All right, so that'll do it for carbon monoxide. Stay safe out there. Thanks for watching.